We're here at the Ripjack Inn in Playa Grande, Costa Rica, teaching a meditation retreat. And I thought I'd make another video in our series on oral health, because the health of your teeth and gums can decide the health of your entire body. That's because much of the bacteria in your body starts in your mouth. So if it's bad, which can easily happen with a modern diet of highly processed food, sugar, sodas, and alcohol, combined with people not flossing or using interdental brushes like I do, then these bacteria can get into your gums and start eating away at your teeth, also weakening your bones, and will also start to make calcium deposits in your arteries and your heart. So infections in the mouth that many people have cause a risk factor for heart disease and diabetes. Now, mouth bacteria is also linked to tumors, cancer, and the health of your lungs, and so much more. And bad bacteria from your mouth also gets into your intestines, and then you have a whole list of other issues, including immunity and mental health issues. This is why I have a whole series on videos for oral health and even more blogs. So if you haven't seen them yet, I have videos on remineralization, why some people have bad breath all the time and how to get rid of that, gum health, natural ways to remove bacteria, natural whitening methods, how to make your own toothpaste, the dangers of commercial toothpaste, and so much more. And according to my hygienist, most people are brushing wrong. She showed me a few techniques, including a 5-count brushing technique that I really like. So I'm going to show you how to do that, and I'll have some more techniques at the end, including how to see a dental hygienist for just $20. So check that out.
So whenever you are brushing, you're going to angle this 45 degrees into the gum line. You're not going to be on top of it. You're not going to be like this. 45 degrees, vibrate, 1, 2, 3, 4, 5, go up. 1, 2, 3, 4, 5, up. Same thing for the inside. Make sure you're angling. You're not on top of the gum or not just the tooth. You're kind of in the sulcus of it.
Okay.
Okay? Same thing here. Very important, which a lot of people don't do. You would think that when you want to get behind these teeth, you do this. Wrong. That's not what you're doing. So you're going to take your brush, you're going to go vertical. You're going to place it there. It's going to be kind of on the gum line as well as the tooth. Same thing. 1, 2, 3, 4, 5, up. 1, 2, 3, 4, 5, up. Take your time with each tooth. The same thing for the top. When you're doing the tongue side of your teeth, again, you're not just doing that. That's not going to do the trick. Vertical again. 1, 2, 3, 4, 5, down. Same thing for the sides. You're just going to count to yourself to make sure that you're doing the right amount of time. But always vibrate at your angle with this into the sulcus of the gum. Hold down. Hold down. When you're here, you're going up.
Okay.
On your chewing surfaces, that's okay to scrub. Scrub as much as you want. But you're not, when you're just doing this, when your teeth are closed and you're doing this, you're just putting the plaque back and forth, back and forth.
Okay.
Which is why you're going to stay open. You're going to do one arch at a time. One arch at a time.
When you have a mineral buildup, where does that happen? Why? And how do you eliminate that?
Most mineral buildups, almost for so many people, is happening behind your front bottom teeth. You have salivary glands here, and the same thing on the top teeth. You have salivary glands on your cheek side over here. So a lot of people are getting calculus or hard tartar here, but mostly is here.
Okay.
Because this is stimulated salivary gland, which means when it gets stimulated, it makes saliva. This is resting, which means it's just going to keep making it. So you have a lot of minerals inside of that saliva, and when it builds up, it's going to get behind here. When it gets behind here, what happens? You can start getting bone loss, all those issues.
Okay.
So this is very important to not only brush vertically, but it's also the flossing here too. You can't give up on the flossing. A lot of people say, I'm brushing, but you're not flossing.
Okay.
And what's going to happen? You're going to get it in between, and then it's still going to bring down your gum level. You're going to start getting recession. It's going to look like that. Okay? And when the gum goes, the bone goes with it.
Okay.
And bone loss is not reversible.
And other tips you had mentioned was not
There's-
brushing before 30
No.
minutes after you
So,
eat.
exactly. So, let's say you have a cup of coffee. If you brush right after you have that cup of coffee, there's a lot of acids in that. You're just brushing those acids into it. And the same thing, let's say you vomited, right? The same thing is a lot of stomach acid, especially with that. You're basically brushing it into your enamel. Why would you do that? Wait 30 minutes, then you can brush. But it's also the same thing when you eat. So let's say you have something acidic as well. You need to let your mouth neutralize. So your mouth will neutralize.
Okay.
The more acidic that your mouth is, the more you're going to have cavities. But the more basic that your mouth is, the more you're going to have calculus. You
Okay.
want neutral.
Okay.
See, let's just say cake all day, right? You have one piece of cake and you're like, oh, I just had a little bit. You're keeping your mouth acidic for that long.
Okay.
If you're going to have the sweet, just eat the whole thing.
Okay.
Wait 30
Oh.
minutes, then brush.
Okay.
So number one, it's because you don't want it to stay acidic for that long.
Okay.
And number two, because you don't want to brush it into your teeth.
Okay. If you like gargle with apple cider vinegar, same thing. You don't want to brush that off.
No, not
Don't
right
brush
away.
that off.
Just wait. The best thing to do, and what my professors have said also, rinse with water. Just swish your mouth with water. Little kids also, so little kids aren't going to brush all the time.
Yeah.
And you don't want them to get like childhood caries.
Yeah.
Have them rinse. Just swish around with water in
Okay.
between meals, even for you.
Okay.
Mhm.
And you say soft bristles and
Always.
brush soft?
Yes.
Brush as soft as possible.
People get recession here. You can get recession for many reasons, but you can get recession because you're going crazy with hard bristle or medium bristle.
Okay.
You don't need a lot of pressure. You just
Okay.
need to do it right.
Okay.
You know what I'm saying? It's
So smarter, not harder. like you
smarter,
said.
not harder. Yeah,
Okay.
yeah.
You're right. Great.
And flossing, please. If you floss very well, it's equal to like 5 times brushing.
Okay.
You know what I'm saying?
Yeah.
Flossing is very, very, very important. I don't know
Okay.
how you do it, but just make sure you do it.
Okay. And do you have anything to say regarding sugar in the with
Well, that's the same thing. Sugar is acidic.
Okay.
Acidity
Uh-huh.
makes cavities. The mouth wants to be neutral.
Okay.
If you're gonna have sugar, do not have it in prolonged. Like I said, don't sip it. Don't
Yeah.
let it last throughout the day.
Yeah. Yeah.
Your mouth needs time to neutralize.
Okay. No, so don't have like sucking candies and things like that, especially bad.
Sugar free.
Okay.
So there's dry mouth sucking candies that are sugar free that are great. It has xylitol in it. So
Okay.
it stimulates saliva for certain people that if they have super dry mouths, issues like that, that can cause caries also.
Okay.
You just want to stay away from prolonged sugar, stay away from prolonged acid, teas, coffee, soda, energy drinks.
Okay.
If you're going to have it in one shot. Or if you're going to have it,
Yeah.
maybe follow it with something neutralized,
Okay.
you know?
And you like the electric round toothbrush the best?
Because look at our teeth, right? Or this is just for show. This isn't, I mean,
Yeah.
a lot of people use this, but if
Yeah.
you have a round one,
Uh-huh.
it's circular, right?
Okay.
It's going to go to the grooves. It's going to go to the roundness of the tooth.
Okay.
If you think of it this way, with this, I have to angle it weird.
Yeah.
When you have something round, all it is just
Okay.
slightly arching it.
Right.
So I think that it gets better into the crevices
Okay.
than this. Although, if you're going to brush with any, do it. You know what I'm saying?
Yeah.
If people want to do flossers, use flossers. If
Okay.
I say string is better,
Uh-huh.
but it's up to you.
Okay.
As long as you're doing something
All right.
is the most important.
Great. Thank you.
You're welcome.
So to summarize, don't brush your teeth for 30 minutes after you eat or drink. Instead, rinse with water, especially with acidic foods like sugar, sodas, or processed foods, and also apple cider vinegar or any kind of tea, including herbal tea. And also, if you have reflux or happen to vomit, just rinse with water after that, and then brush 30 minutes later. Brush up for the bottom teeth and down for the top. Brush with a soft bristle brush. Remember, smarter, not harder. Get a rounded or small head electric toothbrush. Angle vertical for the front of your teeth. And if you're going to eat sugar, have it all at once, not in pieces throughout the day or sipping sugary drinks throughout your day. Then rinse with water after that, or if you want, you can wait 30 minutes and brush. And finally, I'll add, if you don't want to get a new toothbrush every few weeks, or especially after you've been sick, soak your toothbrush in hydrogen peroxide for about 30 minutes and it will kill all the germs in there. And keep in mind, you really want to go to a hygienist that cleans your teeth at least every 6 months. I know there are people who say that they don't like to go to the dentist, but if you're scared of that, then how scared are you of losing your teeth? Because people who don't go to get cleanings are usually the people who typically need root canals, which are unfortunately linked to cancer, and these are the people who need to get dentures according to experts. So your teeth might seem okay on the outside for now, but bacteria could be building up in your gums and in the roots, and that can be easily scraped away if you just get your teeth cleanings. If you don't have insurance, a great option for you could be to go to a dental hygienist school, because most schools are looking for people to work on with their graduating students, and their work is great, and even deep cleanings will only cost you $20 in most cases, saving you hundreds or thousands of dollars. So Google dental schools near you. And as a final tip regarding drinking alcohol, this causes dry mouth, which is not producing enough saliva or enzymes in your mouth to balance the pH and start your digestive process. This can cause many problems, especially associated with the liver and kidneys, and most of your food then goes undigested, creating fuel for parasites, and you're also not creating the minerals your teeth needs for their health. This is covered in much more detail in my seminar called The Instruction Manual for the Human Body, and there's a link below to learn more about that. And essentially, that offers a mind, body, and spirit approach to your best possible health. So I hope you found this helpful, and don't forget to subscribe and hit the notification bell for more videos on mind, body, and spirit. And if you're interested, I'll have a link for the Rip Jack Inn in Playa Grande, Costa Rica as well. I hope this has been helpful for you. Good luck.